that I am holding that has a light source. And I'm just doing the subcutaneous dissection, releasing all the osteocutaneous ligaments so that I have a nice clear view of the full skin. So here I am excising step by step the ligaments. And now this is the buccal fat pad. You can also remove the buccal fat pad through the same. So if you see, I decided the vectors on the table before taking her to the table. In fact, I decided the vectors where I want the skin to be pulled. And if you see, I'm applying with the forceps, I'm applying traction on the SMAS, and you can see the whole neck and the lower face has been lifted. She's a young model who wanted to have more well-defined features, and she started to have jowls here. So I wanted to pick up that and tighten up her face. And this is the needle holder that we use. And now if you see, I am picking up the SMAS from where I decided pre-operatively that I want the pull. And here I take a deep bite on the SMAS, and I fix it with the temporal fascia. So it's very simple, easy. You go subcutaneous, release everything, and then if you see, when I put the traction, the whole neck and the lower face moves. So here I put 3 or 4 sutures, one to pick up her lower neck, just below the lobule of the ear, then one close to the marionette line, one close to the nasolabial, one for the malar fat pad. So here I am for myself, so I am bruised. So I put all the 3 sutures, so I'll show you one side. So if you see the ear incision, these people fear that they don't want the ear scar because it takes time. Usually it does not scar, but then people are not that convincing. So they buy endoscopic facelift more than the classical facelift, but my favorite is classical. Anyone who's above 35 age group, not 35, sorry, 40. For younger age group, I take this endoscopic facelift. So you see this is now the second bite close to, there is no volume in the video because I had described everything in the video. So this is the second vector of the pull in this mask. And while pulling it up, you can see her whole nasal, the marionette. This is the second suture. Then I'll apply the third suture on the nasolabial fold. It's a very simple technique. It takes me 30 to 35 minutes to do this entire thing. And there is no scarring also. So that this direction was decided pre-operatively. The girls wanted a vertical facelift and not a transverse. So I'm going to put one in the nasolabial, and my assistant will show heel down. See, this is the direction, and I'm going to pick up all the tissues and one stitch here. So what I'm doing, I'm taking all the stitches in this mask here, what we do in the facelift. So these vectors were decided pre-operatively. So there's another maneuver which I do. I take out this. That is the deep fat pad. That is for the nasolabial fold. So my assistant will thread the thread through the inside the buccal cavity, and I'll use this thread to pick up the deep fat fold, and so that the nasolabial fold is stretched. So you can see the maneuver here. So it's going to be threaded back to the eye of the needle, and I'm going to pull it back to the same. You see here, and when I pull it, her nasolabial fold will get better. So a lot of young kids, they are very bothered about nasolabial folds, which are resistant to fillers and majority of other techniques. So this was, now coming on to the same patient, this was how she looked before. She wanted to participate in Miss India International, but because of this look, she was not confident enough. So I did a division rhinoplasty and the endoscopic facelift. This is her third week, and she was up working. This is revision rhino, and this is another young patient of mine. She's a famous tarot card reader. Another patient from US who had come for endoscopic. After seeing this friend of hers who I operated, same I did endoscopic revision lift for her. Now another young doctor from Maldives. She wanted an endoscopic ponytail lift. I did a laser resurfacing also for her along with Zio. This is another, he's a famous designer. He wanted to walk the ramp and I did an endoscopic facelift for him. This is another model. I did a revision rhinoplasty and an endoscopic facelift for him.